Welcome back. We are still at Davana Hotel, and on set we have a counseling psychologist who is going to assist us in understanding mental health to do with lupus patients. As we get to that point, we will have a moment where Evelyn, our guest today, and our counseling psychologist today will have one-on-one and help her understand, and her people, and even those who are watching us. That's why we are here, to inform, to sensitize, and to help the community understand that there is mental need to be enhanced. Thank you for joining us. Karibu, our guest.
Thank you. It's nice to be here. How are you, Frank?
Very well.
Yeah.
Most of you have interacted with her on various platforms, on Limelight Media, on YouTube, and you're here again on this matter. So you can introduce yourself again for those who don't know you.
Yeah, thank you. So my name is Waithera Reuben, Jane. I'm a counseling psychologist, and I'm a very passionate person to do with issues of mental health, and that's why we are here today. Welcome, everyone.
So before we get to her, we were discussing Evelyn's story on how she got diagnosed with lupus and how her people have been treating her. And she also came up with the idea on how the community is supposed to carry out the matter. But before we get to talk to the psychologist about the mental health, we wanted to understand, Evelyn, you've been going through difficult times in financing those treatments, and we wanted to know whether you have been able to raise funds, whether there is an organization that brings in together people who are suffering from the same, or what is your daily hustle to make money, to make ends meet?
I was working full-time before the disease was progressing. For this year alone, I've been admitted 4 times in hospital. And each time it's taking a week because the medicine also takes longer period of time because of the injectables. So every time for an employer to have me sick, I was taking these sick off sheets. Sometimes I'm not paid because of COVID. And sometime last month, they just called me and told me they didn't renew my contract. It broke my heart because as much as I have lupus, I've been very energetic. I don't miss work when I'm not sick. I'm very passionate with what I do. So when they didn't renew my contract, actually my last pay was done, the check is in the bank for the days I worked. So I decided to have a side hustle. I cook for people, maybe parties. If you have a party, you call me, I cook for you. I have 2 people who help me do the things. I also do t-shirts, jumpers, of course with the lupus educative message, like this one here.
Oh, okay.
It can have different messages, like this one has someone I know has lupus.
Yeah.
Or you can say someone I love has, my husband has one, someone I love has lupus.
Yeah.
It has different messages. So for now, I'm not working, but I'm doing the side hustles for cooking, outside catering, and also for these things that I sell.
We should know that side hustle that you do. You say you're in catering department.
Yes.
Or cooking for people. Is it by the love of doing that, or did you study on that line, or it's a passion?
It's a passion, and the cost effective was friendly. Because even if I wanted to start something big, I can't because of the finances. Lupus has drained me completely. So normally, each visit I make to the doctors is 4,000. I have every visit every Tuesday. So every Tuesday I have to see my doctor. And for the insurance, when they realize that you're going regular visits, they remove you from the covers. So I was from resolution to CIC and all that. But for now, I am only like, every visit I make, I go, I pay cash.
Okay.
That is why I work so hard, like doing other things.
And how much do you sell your jumpers, like this one you have shown us?
And this one goes for 2,500.
Yeah.
Yes.
With the branding on it?
Yes.
So you do the branding yourself?
I have someone who does it.
Okay.
Yes.
So that is cost effective?
Yes.
Buying
Because the color itself has to be purple.
Yeah.
It's not a normal color that you find. Normally they do black and white. Yeah, when you request for this color, for the Lupus logo,
Yeah.
they charge you more.
And where do we sell, or rather, where do you sell them from?
I have some small food court I have in Kitengela. I sell them there. Yes.
But these days, the market is becoming online, so you can go digital?
Yes, I do sometimes, but you see with lupus also, you have so much stress and anxiety. Your days are not the same every day. Sometimes I don't even have a mood to answer my phone. I don't even go through my messages. Sometimes I'm sleeping like the whole day. There is memory loss. Unasahau karibu kila kitu. Nishawahi enda kwa ATM, nimetoa pesa na nikasahau pesa, lakini nikachukua kadi na receipt, so nikacha pesa hapo. Nikifika kwa supermarket sina pesa. Not once. You forget like everything.
So there is memory loss as one of the
Yes,
side
a
effects?
lot of memory loss.
Uh-huh.
Fatigue, kuchoka. Hujafanya chochote lakini huwezi panda hata stairs. Fatigue ndio mingi.
Okay, so I think for the people out there to reach you, we can have your number displayed on the episode so that they can reach on you to make orders for these jumpers and the t-shirts,
Yeah.
and even those who may want to have you on their events for catering purposes.
Yeah.
So now we have Jane, our counselor, and we have understood that there is that emotional stress that you go through. And Jane, as a psychologist, how can you help our friend and those out there who go through such mental conditions due to the reactions they experience from the people?
All right. Thank you so much. It's nice seeing you, Evelyn. We may need to understand or that living with lupus or even taking care of a person who has lupus has some profound effect on their mental and emotional well-being. So when you hear her talk about anxiety, when you hear her talk about there are days that she doesn't have mood, that she doesn't even want to answer her phone, yes, those are some of the psychological effects of the disease that she's going through. It would be important for maybe the patient to be able to understand that these things are inevitable. These are some of the effects that will come with the disease and the condition, and all they need to do is to be able to understand themselves, have some self-awareness that this is what is going on, so that then they can allow themselves to be. When you feel like at that very moment today, I feel like I do not want to answer to my call, all right, stay with the feeling, but being aware of what you can be able to do. Like you can purpose to, okay, as much as there is that feeling of feeling down and low, it would be important for you to like charge yourself from within, understand that this is what is going on from within myself and I need to do something about it, Yeah, just that awareness is very key. And even for the families out there, I've had people who, the families do not even believe that the person is sick. So they will always assume, they will give them work to do. They will imagine that they need to be also working. And so with the disease, the family and the people taking care of the person need to understand that this is what the person is going through. There are days that they will feel like there is nothing they want to do. Allow them to be as family members, as the significant others. There are days that they will be in too much pain. What can you be able to do at that very moment? Maybe have them visit the clinic or let them take their medication. You know, just being able to have a walk with them step by step will be necessary.
Mm-hmm. Now, as you have heard her say, she would withdraw money from an ATM and forget the cash, but collect the card.
Yes.
Forgetfulness is one of the effects.
Yes.
And this forgetfulness would also make her people not really understand why she is not attending to some family matters. And these people that are too close to you, they need to have an awareness. And how do you deal with them?
Yeah, so it would be very, very important for the family members to also work, you know, purpose to work with the client or the patient. Like they can even accompany them to the hospital so that if there are any questions they need to ask the doctor or any healthcare worker, they can be briefed on whatever it is. So then they also have some understanding, because it could be the patient understands what is going through, because I am sure there's a lot of psychoeducation going on at the health facility. So the doctors are educating whatever condition that they're having. The doctor is actually educating them. So the other thing that the family can be able to do is to also work with the client, support them to go to the clinic, so that then if there are questions that they need answered, if there are things that they need clarified at the hospital, then they can be able to get it right, so that they can also act as a support system for this person to feel better.
Mm-hmm.
Yes.
So in other words, as you're saying, lupus can cause psychosis.
Not really psychosis, but mental health disturbances, mental issues.
Yeah.
Yes.
All right.
Yes.
We have Irene. Her case is different.
Yes.
She hasn't had that mental illness as of yet, but there is that danger when one is suffering from this. Earlier, she spoke about nerves and the sense of knowing that there is the bladder is about to release. Such can cause a problem with dealing with the community. Like how do you feel comfortable even going to public? And the public, you don't know what's going to happen.
Yeah, those are some of the psychological issues that I'm talking about. The psychological disturbances that someone is likely to experience when they have lupus or any other medical condition. The most likely thing that the patient should be able to do is to be able to understand themselves and also understand the disease, such that if there are times that you probably would think that of course people respond differently to medication, and also people will react differently as the disease progresses. So then with the education that they are usually getting from the health facility, or with the education that she's getting from the clinic, the doctor is seeing her, probably those are some of the things that she's being told. So it would be nice to probably know that I may not be able to know when my bladder is likely to release and I need to probably travel. So what are some of the things that I can be able to do? Do I not take water? Of course you can't. Even if you don't take water, you will still, your body's mechanism will have that aspect of wanting to release at one time. So would you want to put on the diapers, or and just to ensure that you are safe, so that then you probably are shielding yourself from what the people outside there will be saying. Or once that happens, because then it can happen at a day when you're not even aware. So be okay with that. I mean, let them also know if someone taps you and tells you, hey, Evelyn, you've sued on yourself or you've peed on yourself, you say thank you, and then probably get to a place where you can tidy yourself up. Have no bad feelings about yourself, because it has to start from you as a person. It's really about you, Evelyn, where you have to really work on your emotions. You have to really work on your well-being, whereby you will be the person to first understand yourself and get to know, such that when people are seeing you They're not actually seeing you and like pitying you. You are okay with that. You know, you have to first be okay with where you are at, such that even if it happens, don't feel like, no, why did it happen? This is the progression of the disease. So you have to be okay with it at first. And when it happens, let it not come as a surprise to them. Tell them you're aware that this could probably be happening and that you're sorry it has happened in their presence. You know, the one that you just talk and you wish away. Yeah, that kind of a thing.
And now, there's also the worry of your future. Like she may have mentioned, you're not sure about tomorrow. How do you get prepared that if tomorrow I'm not there, itakuwaje?
Wow, that's it's a good question to ask. Yes, of course. Again, one of the things that people with terminal illnesses or people who are suffering from conditions that are, you know, that are really taking toll on them, is that one, we really emphasize a lot about, you know, getting to understand yourself. Like if the doctor says that you need to tell people, please tell people. If there are things that maybe you need to do, maybe there's someone who doesn't, maybe your spouse or your husband, your wife doesn't know that you have a certain plot somewhere. You know, start just making things right. If it's a will, of course death is inevitable for all of us, not just for people suffering, because you can actually cross the road and you didn't have any condition and you die, you know. So emphasize a lot on how to be able to live right. Like you have to live well. If you have some properties that probably you think, if I would die, then these will be left, people will not know where this is, tell them. Prepare your children, if you have children, you know, prepare your significant others that in an event I will not be there at any one time, this is how life should be dealt with. You know, like you live your life black and white, you just tell it all. Yeah, and that's the way to not actually prepare yourself to die, but it's the right way to live.
No, I was trying to put it across to her.
Yes.
That faith is one of the reasons why you can look forward to tomorrow. You want to live longer.
Yes.
And maybe here we can ask her, are you afraid of death?
Not really, but you see, when I think of my children, sometimes I break down.
Yeah.
But she says, I've already prepared them in the event that I die today, because, like, you know, they always ask, where is Mama? Where is Mama? All the time I'm in hospital. Hospital, home, hospital, home. So I had to tell them, when you don't see me around, you pray for me, because I'm in hospital. If you pray for me continuously, I'll come out of hospital. So they know. They pray for me every day. Actually, before they go to sleep, they have to pray for me. Hadi wananiambia, Mom, tulikuombea jana, ndio kumbe umepona. You know, like wananiombea every day. My daughter, who is now 10 years old, she understands, because ndio, if I can't put on my bra, atafanya. Because siwezi fanya mikono kwenda nyuma. So, yeah, she'll do the bra, she'll do my shoes. I had to tell her, even I had to educate them what is lupus, even if they're too small to understand. They already know. They know Mama has lupus and Mama will die someday, so they understand. So I don't want them like to be shocked, because there was a time I was really sick, I was in ICU and I didn't know I would come out. So I had to prepare them. I prepare them every day. So the good part with this mental health, even to tell them that if you don't pray for me, something bad will happen, you know. It helps a lot, because even sometimes they tell me, Mom, tulisahau jana akikuomba. Unasikiaje leo? Like,
so they've made it part of.
Yeah, I'm like, you are even lucky that siko mgonjwa. So make sure don't forget to pray for me. So they know they have to pray for their mother. They understand I'm sick. And they know even if I die today, I already told them I'm going to die someday. Yes. Well, so I'm not scared of death.
It's quite,
but I don't want to be in pain. Yeah. Even if I'm dying tomorrow, I don't want to experience this pain I experience when I'm so sick. Yeah. Yeah. But death, I know everyone will die. Yeah.
It takes a lot of courage for someone to talk about their end and so freely, and in fact with their families. So many of us, we are sorrowful when one of us is gone, but it's at peace to that person. And when that person is aware that that is coming so soon because of what they are going through, it takes a lot of heart, courage, and our counselor, can you close this and tell us mentally, how are these people supposed to be ready for anything?
I'm not trying to prepare anyone for death, but what I would like to say is that it would be important for anyone suffering from any condition, not just lupus, because there are also many other ailments. We call them terminal illnesses. If there is anyone with a condition that is maybe chronic and they're feeling like they're losing it, it would be important first and foremost to know that this is where they are at. You know, like be okay with that place. Some of these ailments, like lupus, will come with a lot of pain and fatigue, like she's already saying it. And it is okay to understand yourself and also be aware that this is where I am at. So if you understand yourself and you know how to live with it, then it becomes a very easy task for you to be able to know, even in the next step. Because then, you see many people suffer from what will people say. But if you're okay with where you are at, it becomes very, very easy. So, and of course, when it becomes too much, it will be nice to seek counseling, just for someone to walk with you, stand with you, and help you process some of the emotional and mental disturbances that would come with the disease. Yes.
Thank you so much for joining us. Evelyn, we believe that there is a better tomorrow. As long as you breathe, there will always be a way out. We hope that this one will reach out to many and also help others who may be going through the same or may come across a person who is suffering from the same. Your closing remarks.
What I will appeal to people, I don't want you pity these people who have chronic illness. Pitying alone is not enough. Help them with even chores. Saidiana tu. Sometimes mtu akikupigia kuambia niko kwa chemist, nataka dawa, msaidie tu. Ama ukiona uwezi msaidia, itisha pay bill number, tuma pesa kwa hiyo chemist, mtu apewe dawa. Because uwezi afford hizo dawa, ni expensive sana. Na kwa serikali yetu kama wanaweza yasikia, hii NHIF iweze kutulipia hizo bill zetu. Hata kama ni kulipa full, because honestly ni expensive. Yani, because kama madawa mingi za lupus ni kama tu za cancer, because hizi za painkillers and all that, they're very expensive. Kama NHIF ingekubali tu, iseme tu hao wa chronic illness, wacha tu tuwasaidie in a way or another. Or the government even to chip in. Isikuwe tu ni tunatesekea huko, wazazi wetu hawezi afford. Like me, I'm the firstborn in our family. Na wengi walikuwa wananitegemea, but I don't have a job. My husband is working, but exhaust completely. So kama gava inaweza tu tusaidia, especially upande ya bills tu na madawa. Hata kama wataseta place ya kusema endeni kama ni wapi mpewe hizo dawa for free. Vile tu watu wa HIV wanapewa. Hiyo tu ndio nilikuwa naomba.
Great. You have heard it from the horse's mouth. It's an appeal. The government, communities, and any other NGOs out there. That appeal is legit. It's a legitimate appeal. These people and others who have conditions that have not been catered for in registration, in insurances, come through for them. because we need their ideas, we need their abilities, we need their presence with us. Their families need them. Help them that they may live a better life. It's an appeal. Thank you so much for joining us today. Coming from Davana Hotel, we sign out for Texas Media.